Hey, it's Mel and JD from the LITE Breakfast, and we're here at Hospital Bahagia Ulu Kinta.
And we're here to showcase the good work that's being done here to reintegrate mental health patients back into society. So let's go check out Hospital Bahagia. We're here with Dr Norhayati Nordin, who's the director of Hospital Bahagia Ulu Kinta. Hello, doctor. Good morning.
Hello.
Thank you so much for talking to us.
Yeah, welcome to Hospital Bahagia.
Yeah, this is fascinating because I'm actually originally from Ipoh.
Oh.
And to come here, it's fascinating because I've never actually been here.
Oh, I see.
Can you tell us a little bit about the facilities here first before we begin?
Okay, basically Hospital Bahagia is one of the 4 institutions in Malaysia. It's the biggest institution in Malaysia. At this point in time, is 109 years old.
109.
Yeah, and our oldest patient now is 107.
Wow!
Yes. If you take care of a mentally ill patient, they can survive longer than us actually.
So, but we're not saying that he's been here since he was
no.
the beginning though, right?
Yeah, some
But,
of them are
yeah.
even before Merdeka. But it's not that they are not well. Sometimes they don't have family to go back to.
Now, doctor, how important is it for us to seek help for our mental well-being?
Seeking help should be part of our normal routine. Anything that we are stuck with, we should get help. But you know, when we realize that we wanted help because we are not well, we know we are sick. But sometimes, unfortunately, I don't know whether fortunately, when you have mental illness, you don't feel the pain. It depends on what illness you have. You have something that makes you happy, but it's a part of mental illness. Of course, you will like to be in that happy environment.
Right.
But sometimes it can cause disturbances to other people.
I see. So it's not so much about, oh, I'm sick, I need help. It's
Yeah.
more about, oh no,
Yeah.
he needs help, but the
Yes,
person doesn't really know that they need
yes.
help.
If
Because-
it's disrupting their everyday normal life or people
Yes,
around
true.
them.
Yeah, because if you look at the symptoms in mental illness, I think almost all the symptoms, every one of us have that experience, but it's very transient. But for people to have mental illness, the symptoms are long-lasting and has affected you to the level that you can't function normally.
Right.
Like a very simple, you know, a child who is crying, but if you're crying the whole day and you can't go to school, something is not right.
So what are the different types of treatment or
Treatment,
how
okay.
different types of patients that you get here in hospital?
Okay, basically admissions lah. We have outpatient and inpatient
Yes.
treatment. When patients who are not danger to themselves, not danger to others and properties, we allow them to go back and if they have their family support. And if those who are more serious or sometimes, even though they are not serious, when we think the diagnosis is so tricky, medication side effects on it, we do admit them. So we will admit them. Now with the Mental Health Act, we can admit them in few different ways. One, they can come when they have the capacity. They say, doctor, I think I'm not well. I think I'm going to injure myself. Can I get admitted? Yes, we'll let them admit through their own request. Sometimes for those who do not realize that they have mental illness, they are a bit aggressive. The family couldn't contain them. The family will come, doctor, can I bring my daughter to be admitted because we can't manage her at home, and we can admit them with the doctor, and the doctor assess, okay, I think she needs admission, we'll admit. That is through family's request. The second one, sometimes there's no family, they wander around, the police bring them in, the police will bring them in and the doctor will assess, yes, they need admission, then will come through police.
All right.
Okay. So, and the other group of people that come is those who have committed crime, that the court ordered them to be assessed for their insanity or fitness to plead, then they will get into our forensic ward. There are the 4 different ways how they can get admitted here.
Do you remember any like a really bad case that came in and then you managed to rehabilitate that person and now that person is back in
Bahagia,
society?
because I'm the director, I don't really see a lot of cases. And now I'm doing child and adolescent,
Yeah.
so not that bad. But cases in the ward, they can be very aggressive. Sometimes my staff will be injured, fracture when trying to contain them. They can
And
be
then
very,
has any of these actually been like rehabilitated?
Yeah. You know, when they are aggressive, sometimes you don't even have to rehabilitate them. You give them enough medication, they settle, and sometimes they can even go back to work.
Right, but medication is not always the best way to go, is it?
No, I think mental health is about multiple treatment modality, because medication is just I always like to use analogy. Medication is just like a petrol. If you fill in your car with full tank, if you have no tire, it still can't move.
I like that.
I like that
That works.
analogy. It makes sense.
Yeah, it
you
has
know?
to be together.
It makes sense.
That's why I told my kids, when I see them when they have major depressive disorder, depression, because it's no, say, no doctor, I don't want medication, I want counselling, cannot. It's when you want to fight, you have to have a fist. Medication, family, food, your skills.
Right.
You cannot fight with another person with just one finger. You
like
have to all together.
It's like going to war.
So no one is better than the other. It has to be
Right.
together. Medication, family. And sometimes it's just coming to hospital and no family support. You will just relapse.